and a few other things about the basic procedure, what to expect. My reading, my viewing suggests that it is painless. I was a bit surprised when I found that out. I also read some stuff which suggests that typically radiotherapy would not cause hair loss. Dr. Aite will handle some of those things as we move ahead. Remember, WhatsApp 055 1111 997. We're live on Facebook and YouTube, and the phone line 030-221-6541.
Joy 99.7 FM.
Right, Dr. Aite. So coming back again, targeted radiotherapy. I understand now technology is so far advanced that it can be pinpoint almost bullseye, if not bullseye, with regard to the regions or the areas of tissue that have to receive the radiotherapy or the waves involved. Can you explain that to my listeners? Because many people want to understand, well, how do you protect areas which are okay? And how do you prevent collateral damage to cells that are normal and not cancerous?
Okay, so I'm excited you've asked this question. Let me say something about the different ways in which cancer cells and normal cells behave.
Okay.
It's this difference that we take advantage of for radiotherapy. So for the cancer cells, the abnormal cells, the most important thing for them is growing, right? So multiplying in number. They usually are not interested in making sure that the new cells that are produced are healthy in food, right? So all they're interested in is growing. For normal cells, however, it's important for the normal cell that if there's any abnormality within the cell, that it is corrected. Now, when we give radiation to cells, it causes damage in the DNA. Now, this damage that is caused in a normal cell, the cell will stop growing and make corrections to that damage.
Okay.
Once the correction is made, then the body will allow the cell to go through and then divide some more.
Okay.
When it comes to cancer cells, that's wasting time to make the corrections. They don't do.
Okay.
So the damage that the radiation causes, actually in the end, causes the cell to die because the damage is not corrected.
Okay.
Right. So even if there are side effects to radiotherapy, often the normal cells will recover.
Okay.
But the abnormal cells will not.
Right.
Now, these days, we actually use what we call three-dimensional conformal radiotherapy.
Right.
What happens is that the area where we need to treat, whether it's the breast or the chest wall, we take CT scans of the area. And then using a machine called the treatment planning system, we actually isolate the areas. So if it's the breast, we isolate the breast by drawing contours around the breast.
Okay.
Once we've done that, then a physicist will come up with a plan by directing the radiation waves to the area where we want to treat. In fact, these days, there's also what we call IMRT, where you tell a machine what you want it to do.
Right.
And it's available in Accra. And the machine will come up with a plan that ensures that only the area we want to target is treated.
Right.
The surrounding areas, the machine or the physicist makes a conscious effort to avoid those areas.
Okay.
Plus, there are guidelines to the maximum and the minimum that the areas around it should receive.
Okay.
And these are strictly adhered to make sure that there are no side effects, or if there would be, there are very few side effects.
Okie dokie. Right. So advanced therapy, advanced science ensures that, should I say, the optimum dose and the minimal, side effects or
Damage,
negative outcomes ensue. So you're safe. And all of this, folks listening to me, is available here in our country, and we have the specialists. Maybe later I'll ask how many of them there are, but we have the specialists to administer this form of treatment, radiotherapy, to you effectively and safely. If you have any questions, concerns, WhatsApp is 055 11 997. My phone line is active. Abeg, do I have anything on WhatsApp? If I can just shift from the Zoom screen and have a look and read out a couple of those. Okie dokie. People are in business already. This one says, good afternoon, Nortey. Please, we all know that the services rendered by Kolebu Hospital is relatively cheaper and breast cancer is synonymous with mammogram, but it is alleged that mammogram machines at the hospital are not functioning. Is it possible to verify this for us? This is from Ifwa in Osu. I hope Doc can hear me and note down these questions as I read through them. Let me see. Which is... Okay. These are not with me. Abeku, can we... Please, is radiotherapy more effective than chemotherapy? In terms of comprehensive treatment, how affordable is it to ordinary patients? All right, no name there, but we'll address that. This one says, good afternoon, Nortey. How are you and doctor? Please, apart from cancer cells that we want to be eliminated from the body of the person using radiotherapy, how do other cells that are destroyed by action come back to life again? Hayford in Bato, I hope you're recovering from the flood you mentioned, or the flood impact you mentioned last week. Dr. Ayete has addressed that. The normal cells will rejuvenate, and the abnormal cells are unable to survive what the radiotherapy does to them, so that is how they rejuvenate and restore. All right, so that answers that. This one says, hello, Doc. I lost my sister to breast cancer in 2022. She had her left breast removed or taken off, and she was told that every cancer cell was taken out. Only a few years after the surgery, she had to undergo another surgery. She was going for monthly chemo and checkups, but she wasn't told the cell had spread across her system, which got to a point that nothing could be done. This is a worry because my granny passed through cancer, and my auntie and my sister. What can I do apart from the regular checks to avoid getting it? This is from Mausi in Pokwase. I think Yep. Doc Aite, can we address some of these things? The first one was about mammogram not working in Kolebu. Are you able to give us an update on that?
Unfortunately, I'm not.
Okay.
I can't say for sure.
Right.
But if it's not working, I'm sure they're working on it.
Okie dokie. Hayford wanted some re-clarification about healthy cells rejuvenating and restoring themselves after radiotherapy. I think you explained that earlier.
Yes, that we spoke about. Yes, the damage for the cancer cells, those are not repaired.
Okay.
And so they would die, but the normal cells would recover.
Okay. I have a question asking comparatively, which is more effective? I think it's Pa Solo from Doma Ahenkro. Radiotherapy or chemotherapy? People want a comparative, should I say, analysis.
Yes. Unfortunately, we don't get to do that. It's not one or the other.
Okay.
It's usually the two together.
Right.
Yes. So the chemotherapy is systemic. It goes around the body to kill all the cancer cells that may have spread. And the radiotherapy is more localized treatment to add on to the surgery for the cells that are subclinical that we may never find, even if we look at it under the microscope.
Okie dokie. Right. Thank you, Doc. And then there was a lady, I believe a lady, sharing the experience of her sister. She sadly lost her sister, right? She lost her in 2022, but she'd already had left breast taken off and was told or given feedback that every cancer cell had been taken out in the mastectomy. Only a few years after the surgery, she had to undergo yet another surgery. After that, she was going for monthly chemo and checkups, but wasn't told from this sister's, from Mausi's report, that the cells had spread across her system to a point where nothing much could be done. She said this is a worry to her, Mausi, who's sharing this, because she lost her grandmother and an aunt and a sister. Currently, she does her regular checks. What else should she be doing?
Okay, so there are actually two parts of Mausi's question.
Right.
The first one is in relation to her sister and the cancer progressing even after she had had adequate treatment.
Right.
So one of the reasons why we say let's find your cancer early is because in a population of small cancer cells, the inherent differences within the cells are few.
Right.
So that the treatment we give is most likely to deal with the cancer completely.
Okay.
If you have a bigger cancer that is more than 5 centimeters,
Right.
there are different clones of cells in there, which means that you need multiple things to do with all of these different cancer cells,
Okay.
right?
Right.
The other thing you need to understand is that we don't have tests that are comprehensive enough to find every single small cell
Right.
that is abnormal.
Okay.
And also the truth is that even if you have one abnormal cell left in the body, and it can take up to 20 years, 30 years, given the right conditions, that one cell will be able to go back into a cancer. It's the reason why even when we finish treating you for cancer, we never let you go away completely. We continue to follow you up. So there's always a small probability that the cancer can come back.
Right.
So for her sister,
yeah,
it just could have meant that the cancer was big. And so even though all of the treatment was given, a few of the cells survived, and over time they grew back. I'm so sorry that she lost her. But there's a lot that she can do for herself.
Right.
She's spoken about multiple relatives and first-degree relatives haven't had breast cancer. That means she is at risk of having breast cancer.
Okay.
Her daughters will be at risk of having breast cancer as well.
Right.
So for her, there may be some genetic reason for the cancer.
Okay.
And there are tests that we can do to find out if she has that genetic abnormality.
Okay. Right. So
the other thing that she can do is regular mammogram so that we can find her cancer early and intervene quickly.
Okay.
At a point where it's small. But there's also some other things that can be done. And I'm sure most of you have heard about the Angelina Jolie effect.
Yeah.
Where people who have genetic predisposition to cancer can actually prevent the cancer from coming by removing the breast.
Right.
Even at the time when there's no cancer. So that is also an option. It reduces the risk quite a bit, but it's not completely removed because there are other cancers that can arise because of that genetic abnormality as well.
Right.
But so she should regularly do her mammogram.
Right.
See her doctor if it's possible for the test. And then we'll take it from there.
Right. 47 minutes past the hour 2 on Joy 99.7 FM. Ultimate Health. We're talking about radiotherapy with Dr. Nadoko Aite, senior specialist clinical oncologist with the Kolebu Teaching Hospital. Just responding to some of the WhatsApp messages if you have any. The WhatsApp is 055 11 11 997. Phone line 030-221-6541. We're live on Facebook. For those who are having problems, Facebook and YouTube have been restored. The day in Maryland, I hope that sorts you out. But Doc Aite, you will agree with me that the Angelina Jolie example is a rather extreme one. She's quite loaded. But she chose based on family history and the genetics of it to have both breasts removed, even though she didn't have cancer. And life has continued for her, should I say, on a high profile. But for the average woman, that's a bit of an extreme leap of faith. But I understand why you put that in there for Mausi. Let's look again at the... okay, I have a caller on the phone line. We'll look at some of the risks, factors, and then some of the side effects of radiotherapy. I have a caller. Hello, good afternoon.
Good afternoon, Nortey.
Right, good afternoon. Who am I speaking to?
Claude. I'm calling from Tema.
Claude from Tema. You're most welcome. Share with us.
Yes, Nortey, I want to know. They always say it's genetic, but is there the possibility that exposure to certain chemicals, these days we have a lot of exposure to chemicals in food, paint, makeups and things. Over a long period, can they trigger cancer?
Okay, good question. Claude wants to know, apart from these genetic or familial indicators and, should I say, antecedents? Can you be exposed to chemicals or other things through food, etc., that could cause breast cancer, Dr. Aite?
Right. So, in fact, when it comes to genetics, only 10 to 15% of patients with breast cancer actually have a genetic predisposition. For majority of our cancer patients, they are sporadic. They may not have any family history at all, right? But the important risk factors are being a female,
Okay. Yeah.
growing,
So age, being
yes,
female, right?
your sex,
Yeah.
yes, exactly. Your reproductive history, so being nulliparous, not having a child at all,
If you haven't had a
increases
child,
your risk.
right?
You have increased risk, yes.
Okay.
If you had your first child at an older age, about age 35,
Right.
you have increased risk as well.
Okay.
Being obese
Mm-hmm.
is a risk factor, not exercising. It's a risk factor.
Okay.
When it comes to chemicals, we don't have any, well, maybe the carcinogens from cigarette smoking and alcohol.
Right.
They put you at risk of developing breast cancer. But currently, we don't have any evidence of chemicals in makeup or any of the things that Claude mentioned that puts you at risk of developing breast cancer specifically.
Okay.
Maybe other cancers, but not breast cancer.
Okay, great stuff. All right, we have about 10 minutes to go. I'm trying to squeeze all the juice from Dr. Aite before I let her go. She's joining us via Zoom from Madrid in Spain. Doc, are there any risks? And then can we talk about side effects of chemotherapy? I know there are lots of benefits that you've already, should I say, alluded to, but let's talk about risks and side effects.
Yes, of radiotherapy.
Yes.
So, Nortey, radiotherapy is usually delivered in daily doses.
Okay.
Over a period of between 3 to 5 weeks. In the beginning of radiotherapy, everybody had radiotherapy for 5 weeks. So you came to the hospital every Monday to Friday, and then you did that 5 consecutive weeks. These days, we found other ways of delivering the radiotherapy over a shorter time.
Okay.
So some people receive it over 3 weeks. And in fact, there are even ways of giving you the radiotherapy within just 1 week.
Okay.
So it doesn't take too much time. So time is one of the problems with radiotherapy, but it doesn't take long.
Mm-hmm.
The treatment itself will take maybe 15, 20 minutes. You get to the hospital, you are positioned, you receive the radiation, and you go. You can't actually even go to work after that.
Okay.
But it does have a few side effects.
Right.
And the side effects can be grouped into two. There's the acute one, which happens while you are receiving the treatment and up to 6 months after the treatment.
Okay.
And then you can have the chronic. So the acute one of the commonest things that patients complain about is tiredness, fatigue.
Fatigue, right.
Yes. So as part of the radiotherapy, patients complain that they feel like they are tired or the muscle feels a bit weak. We know that can happen. And in fact, the way to counteract that is to do a bit of exercise.
Okay.
That actually improves the fatigue. Then while you are receiving the radiotherapy as well, the area where we are treating can develop some ulceration. The radiotherapy itself is not painful.
All right.
When you deliver it, no pain at all. It's like doing a CT scan.
Okay.
But over time, because the DNA in the cells are being damaged, the cells can become ulcerated. The skin can become ulcerated,
Okay.
right? What we call disformation.
Okay.
And it can be dry or it can be moist.
So,
But it's superficial and
Right.
heals quickly.
right.
So often your doctor will give you a break from the treatment.
Okay.
You recover and then you resume the treatment.
Okay. Can we cluster
Then
all these under skin irritation or reactions of the skin at the site of delivery?
Yes,
Okay.
correct. You
All
can
right.
say that.
Okay. Right.
Then you can have some side effects much later,
Mm-hmm.
what we call the chronic side effects.
Mm.
And that includes changes in the skin of the breast or the chest wall.
Okay.
So the skin may become a little thicker or a little heavier.
Mm-hmm.
Sometimes the skin may become darker or lighter, so hypopigmented or hyperpigmented.
Right.
Then the rib, which lies immediately behind the breast,
Mm-hmm.
can also receive radiotherapy and become a little brittle
Right.
compared to the side that has not received any radiotherapy at all. So those are some of the side effects that you may have to look out for
Okay.
when you receive radiotherapy.
Right.
All of them are treatable, though, I must say.
Okay. Dede was asking, you seem to mention the possibility, of the person with a family history having her daughters have cancer as well. But she says you left out sons. If we know that men can also have breast cancer.
Yeah, actually, men can. It's just that the likelihood is much lower than women. If you took 100 people with breast cancer, 99 of them will be women. Only 1% will be a man.
Right.
So yes, the sons are at risk as well, but the daughters more than the sons.
Okay. Right. Great. Now, I mean, I'm a bit should I say cautious to ask this, but many people look towards cure. And they very rarely hear this word applied in association with cancer or breast cancer. With the effectiveness of radiotherapy and all that we hear, are we able to talk of cure in some instances? And if we are, why do we get these recurrences that surprise people, especially gleaning from the example Mausi shared from her family?
Nortey, when it comes to cancer and cure, well, so the aim of our treatment, right, is to make sure that for the rest of your life, the cancer doesn't come back.
Mm-hmm.
Yes, or that you may die from a competing rest. So, something else may be the cause of your death.
Okay.
At the time, if you pass without any cancer, you have been cured.
Mm.
But because there's always a probability that even one cell has the ability to grow back, we hesitate to say that you are cured.
Right.
We'll probably say that it appears all the cancer is gone.
Mm-hmm.
But we'll never tell you to go home and never come back to see us.
Okay.
The way we do for malaria, for example, we cannot do that for cancer. And especially if the cancer is advanced at the time we see you.
Right.
And unfortunately, majority of our patients come to us with locally advanced disease. Those who come early, a lot of the time, we see them for the first 5 years, they are doing well, and we say, once in a while, come and show yourselves to us.
Right.
But if you have advanced disease, we cannot say that to you.
Okay. So we are cautiously hopeful. We can eliminate most of the abnormal cells, but to actually put that word cure on things, we'd rather remain cautiously vigilant.
All right.
Right. Now, this 5-year span, it seems to be such an important indicator, 5-year survival. Can you explain that to my listeners, even though we've got only a few minutes left? When we say 5-year survival, that 5-year mark, what's the big deal about the 5 years? Doesn't it sound a bit scary that I've undergone treatment, but I have this 5-year thing hanging over my head?
Right. So, cancer after treatment, the first 3 years, up to about 5 years, that's the time when the person is most vulnerable for the cancer to recur.
Right.
And so the 5-year mark is very important to us. If your cancer doesn't recur within the first 5 years after your treatment, it's unlikely to come back.
Can you say that again slowly, though? No, say that again. I like it, but say it again.
Yes, so I'm saying that within the first 3 to 5 years post-treatment, that's the most likely time that your cancer is going to recur.
Okay.
So often when you've gone past the 5-year mark, the cancer is most unlikely to come back.
Okay. It's unlikely.
So 5 years it is unlikely to come back.
Okay.
So the 5-year mark is very important to us.
Okay.
It also helps us to estimate the likelihood that your cancer may come back. So for very early stage disease, stage 1 and stage 2.
Right.
At 5 years, more than 90% of the patients will still be alive without the cancer having come back.
Okay.
But if you have more advanced disease, stage 3 and stage 4, at 5 years, you have only about 50% of the patients alive.
Okay. So
that's the other benefit of looking at the 5-year mark.
Right. It gives us a sense of prognosis or outlook. And
correct.
Right. The earlier you come, the better and more positive the outlook.
That is true, Nortey.
Okie dokie. Folks, we're wrapping up with Dr. Aite. I've got Dede and somebody else typing 5 years is that one has gone over the hump. Flattening the curve, Dede suggests, right? It's a good indicator. And I hope with most of the caregivers, this will be communicated in a way where it can be harnessed properly and meaningfully and not be that thing that is hanging over your head and scaring you. I've heard some, should I say, religious, let me call them activists for now, misinterpret this. So those are things we need to be mindful of. Doc, you wanted us to end on the highlights, the benefits. But before you run into that quickly, somebody asked, relatively, I mean, cost-wise, is this accessible financially?
So let me say that cancer care is expensive, unfortunately, everywhere in the world.
Oh, boy. Okay.
And radiotherapy is part of the cancer treatment.
Okay.
Unfortunately, it's not covered under the health insurance. It's not cheap. But I often say you have to look at it in terms of what it offers to you, right? Life without cancer. Right. And so even though it might be a little expensive, it's generally affordable. Most of our patients pay out of pocket.
Okay.
Fairly affordable, right. I would say that.
Okie dokie.
It's not cheap though. It's not.
Okie dokie. All right. Thanks, Dr. Nadoko Aite, clinical specialist, clinical senior specialist. I keep on dropping all your tags. Coming to us. I notice you are in Amelia mode. You're out there for a conference, I understand.
Yes, I am. I'm here for the European Society of Medical Oncology conference to learn more about cancer.
Okay. When are you coming back? We will need to get your expertise when it comes to the actual process and procedure and a few other issues that our listeners would want to have clarity on.
I'll be back very soon.
Very, very soon.
Before the month ends, yeah.
Okay. We'll be waiting to welcome you back. Many thanks for enriching our programming this Sunday. Dr. Nadoko Aite, senior specialist, clinical oncologist with the Kolebu Teaching Hospital, sharing with us and giving us the benefits but the full 360 on radiotherapy as one of the pivotal and key treatment modalities when it comes to managing cancer here in Ghana. We're out of time. There's soccer coming up, but let me just, wrap up by giving you the lowdown on the Pop Chain event coming up this Sunday at the Gold Coast Restaurant and Cocktail Bar. Just quickly go over those details so you can remember them. Saturday, on the 28th, the Joint Cancer Project comes off with its Pop Chain Records Night on the 28th. With the Battle of the Old School DJs featuring Belay, Infantsman School, Lexis Bill Presec, Doreen Andor representing and repping St. Rose's and Holy Child schools, and then Andy Dosty representing Prempe. It comes off at the Gold Coast restaurant, and it's important that you take part so that you can contribute to the fundraising, which will be harnessed towards breast cancer awareness, screening support, and some initial primary treatment. The partners are the Gold Coast Restaurant, Cocktail and Cocktail Bar, Millennium Promise Alliance, Cancer Support Network Foundation, Lady Pharmacists Association, and many others. Joy FM, of course, is one of the key salient partners, as well as the Rotary Club of Accra Airport, RCAA. We spoke to Dr. Ben Hagan, immediate past president of the Rotary Club Accra Airport. Join us on Saturday because there'll be lots of jamming to do. I'm out. Sports is coming up next. Stick and stay.